Hello everyone, and welcome back to another quarter here at Rasmussen College. So this course was really built to help you gain knowledge on specific areas of the medical world and the structures of the systems included in those areas. Each week I will use videos to help deliver content to you, as we typically will not meet in person unless you have me as your lab instructor. So for week 1, we are focused on the pulmonary or respiratory system, and we will have 3 chapters that we're looking at. Chapter 29, pages 640 to 647, Chapter 51, pages 1198 to 1210, and Chapter 54, pages 1271 to 1272. So let's go ahead and take a closer look at each one of those chapters. So for Chapter 29, we will start our discussion on the respiratory system. So it's important that you know the organs that are part of this system. That includes the nose, paranasal sinuses, pharynx and larynx, trachea, bronchi, bronchioles, alveoli, and lungs. So the nose is the organ of smell and is the most important component of the respiratory system. The nose has 4 functions outside of that of smell, which are 1, to serve as a passageway for air, 2, warm and moisten the inhaled air, 3, trap dust, pollen, and other foreign objects in the cilia or hair-like projections, and 4, assist in the making of sound for speaking and singing. The paranasal sinuses are the air cavities in the cranial bones near the nose, and they also have 4 parts or 4 pairs of sinuses. The maxillary sinuses, which are over your cheekbones, the front sinuses, which are over your eyebrows, the epididymal sinuses, which are behind your eyes and between your eyes, and the sphenial, which are behind your epididymal. Your pharynx, which is the next organ in the respiratory system, is a tube that lies just beyond and behind the nose and connects the nose, mouth, and larynx. The pharynx is about 5 inches long and consists of muscle and membrane. The major function of your pharynx is to serve as a passageway for food to the esophagus and air to the larynx and trachea. Now, your pharynx also plays a role in your speech by forming specific sounds. Your larynx, which is also known as your voice box, is the next structure we'll talk about. It is a muscular structure that is lined with mucous membranes. Typically, your larynx is found at the end of your pharynx. Your trachea, which is also known as your windpipe, is made up of cartilage that is about 1 inch wide and 4.5 inches long. The trachea serves as an open passageway so that air can reach the lungs. The bronchi are the two main branches that come from the trachea and extend into the lungs. These are the passageway for air from the trachea to the lungs. The bronchioles are tiny structures that are composed of thin layers of epithelial and smooth muscle, and these structures are only about 1 millimeter wide. Then you have your lungs, which are the large cone-shaped organs in the chest. The lungs are porous and spongy in texture and have a high elasticity. There are 2 sets of lungs, one on the right and one on the left. Your right lung is made up of 3 lobes, the bottom, middle, and top. The left lung is only made up of 2 lobes because it has to incorporate the heart. Each lung is about 10 to 12 inches in length. So now that we understand the organs of the respiratory system, let's discuss the act of breathing. When we discuss breathing, it's the movement of air to and from your lungs, and that is called ventilation. This process is made up of 1 inhalation and 1 exhalation. An inhalation is the active process that involves taking a breath in, and exhalation is the passive process of exhaling or breathing out. If a patient's having difficulties breathing, that is called dyspnea. If a patient has a lack or an absence of breathing for more than 19 seconds, that's called apnea. And if the patient's having breathing difficulties in certain positions, that is called orthopnea. So that's going to conclude chapter 29 for us. Let's go ahead and talk about chapter 51. Now, chapter 51 is talking about the study of pulmonology, and that's really the study and treatment of diseases of your respiratory system. That would include those of the trachea, bronchial tubes, lungs, and alveoli. The primary function of your respiratory system is to transport oxygen from the lungs through the bloodstream to all the cells in the body and carry waste products from those cells through the bloodstream to the lungs to be exhaled out. As a medical assistant, it's really important that you play a part in helping the provider to diagnose conditions and diseases of the lungs. This can be done through items such as a pulmonary function test. It could be arterial blood gases, blood volumes, pulse oximetry, or TB testing. You may be asked to perform these when a patient complains of shortness of breath or any difficulty with breathing on exertion. It's important that you also perform these on patients who have asthma, chronic bronchitis, emphysema, or cystic fibrosis. All of these things could be things that could be done in an office, minus that of the arterial blood gases. So let's go ahead and take a look at each one of those individually. A pulmonary function test is also called a spirometry test. This is a non-invasive test that measures the ability of your lungs to exhale. The results reflect the elasticity of the lungs and their ability to ventilate and strengthen the respiratory muscles. As a medical assistant, you will play a very important role as you prepare the patient for the procedure, as you will be their coach throughout the process. You are their cheerleader. You want to teach them, you want to encourage them to keep going, so that way they get the best results possible. When we're doing these, what we're looking for is called the forced vital capacity and the forced expiratory volume. That will give us the patient's ability to breathe out of their lungs. Arterial blood gases are used to measure the amount of oxygen, carbon dioxide, and the pH level of the blood. We typically do ABGs, or arterial blood gases, to help diagnose patients with COPD or pneumonia. And the most important thing I can tell you is when we're doing these, you want to make sure that you're drawing from an artery, not a vein. And typically that can be the wrist, groin, or arm. As medical assistants, we aren't really trained to do this. It is typically done by a trained phlebotomist. Lung volumes, or peak flow meters, are used to measure the patient's ability to move lung into and out of their lungs. We often do this with patients who have asthma, and they do it on a daily basis. Patients will keep an average daily binder or journal so that way they can monitor their lung function. We typically do this about 3 times, and you take the average or the highest attempt of the 3. Pulse oximetry, or oxygen saturation rates, are used to determine the oxygen concentration in the arterial blood. This is necessary to determine if the patient's getting enough blood flow through their veins and through their bloodstream. We can do this on a fingertip or an earlobe, and for little children we can do it on their heel or their toes. You typically want to see a patient's oxygen saturation level between 95 and 100%. It's really important, though, that if a patient does have any painted fingertips or fingernail polish, or their fingertips are very cold, you'll want to remove the fingernail polish and warm up the patient's finger. Otherwise, you will get an inaccurate result. TB testing, as many of you can remember from your first clinical course, is called the Mantoux TB test. It looks for tuberculosis. And when you're performing a TB test, you are going to be placing this just under that first layer of skin on the patient's forearm. They'll have the induration or the raised lump or wheal when you perform it, and then they'll have to come back within 48 to 72 hours to have that read. All right, and the last chapter is chapter 54, which deals with kind of treatment plans for pulmonology. So in these couple of pages you'll be able to discuss the routes and methods of administering medication. With the respiratory system, the main way that you will administer medication is by the inhalation method, which could be nebulizers or inhalers. Some of the reasons that we might do these are COPD, bronchitis, croup, pulmonary edema. We could also have Legionnaire's disease, pleurisy, asthma, and pneumonia. Now, I'm going to put up the PowerPoint so you guys can review those, but all of those are also in your books. I would highly suggest that you read those this week so that way you have a better understanding of each of those diseases. And some of the medications that we use in pulmonology are antihistamines, anti-inflammatories, antitussives, bronchodilators, decongestants, and immunosuppressants. Again, I'm going to put the PowerPoint up so you can review those, but I would also suggest that you guys read your chapters. All right, guys, so this is where I'm going to stop for this week's video. Please make sure that you're reading your suggested readings on your own as well, not just reviewing the video. It will help you have a better grasp of not only the material so you can complete your discussion posts this week, but also for your quizzes and your lab classes. Now, your discussion board is due, your initial post is due Tuesday by midnight, which is October 4th. And for this discussion board, you will want to talk about the spirometry preparation and the coaching method. What you will need to write in your discussion is what you think the proper way to prepare a patient when they need a spirometry test is. You will need to explain also what you think the purpose and importance of coaching the patient through the test are. And you will need to have at least one response to a classmate by Saturday at midnight. I will also put up a grading rubric in the discussion board so you'll know what I will be grading you on. Lastly, you will have your first quiz this week, and it will be over the chapters that we discussed today. It will also go over what you learned in your lecture class and your lab classes. It is an online quiz that consists of 16 questions that are multiple choice, true, false, and 3 short answer essay questions. Please make sure that you complete this quiz Sunday by midnight, and please know that it is timed, so you have a 20-minute time limit. If you have any other questions or concerns, please don't hesitate to reach out to me. I can be reached via email or by phone. Have a wonderful first week, guys, and welcome back. Bye-bye.